Hey everyone, are you suffering from TMJ pain or jaw pain, also known as TMJD? If so, I'm going to show you 3 tips that you can do to try to reduce your pain and kind of improve some of the mobility of your jaw and your neck. The first thing we're going to do is a recommendation of using a warm compress or a heating pad. You want to make sure you're safe to use that, of course. You're going to put that on the jaw somewhere between 15, maybe 25 minutes, 30 minutes, several times a day. It's also a good tip that if you have your jaw kind of get stuck in open lock where you can't close it, you can put that warm compress on there or the heating pad, kind of breathe through it, relax. In a lot of cases, that'll start to relax and your jaw will go back into place where it needs to go. So now the next thing we're going to do is we're going to use one of these little gua sha type tools. So you can go to my website, ChadGOrthoOT.com, go over to my Amazon favorites products, and you're going to find these links to these on there. They're pretty inexpensive. You can use these with or without lotion. And I'm going to go the temporalis muscle here in the temporal area, as well as the masseter muscle here on the side, and then the scalene muscles on the side of the neck. So a lot of times I would just take this, go through slow stroking movements back and forth, up and down, all throughout the area. You can use a little bit of lotion. Some people incorporate this in like their nighttime skincare routines and all that. You can use that for that, just to try to modulate or reduce some of the tone that you're having, kind of, decrease some of that perceived threat in the area and improve kinesthetic awareness to all the tissue and the joints of the TMJ. Now, the last thing you're going to do is going to be an in-range loading strategy for the cervical spine, as well as kind of a neurological reset type exercise. And it's kind of also combining some stretching. A lot of times our patients or that we work with will have a forward head posturing. So the head goes forwards. If your head goes forwards, that pulls on the mandible, your mandible bone gets pulled backwards. And so that can cause the masseter muscles on the side here of the jaw, which are responsible primarily for elevating the jaw, closing the jaw up. It's the most powerful muscles in the body based off of their size. And those can spasm. So we're going to do this little technique to try to help reduce some of that. So what you're going to do is you sit up nice and tall, kind of looking straight ahead. And I'm going to try to kind of bring my head back in this position. I'm going to take my hands, either one hand or both hands, just whatever you feel most comfortable with, and I'm going to push straight back. And I'm going to do that and push back and hold that for somewhere between 3 to 5 seconds and relax. Now what you don't want to do is push yourself into a cervical extension. We're not trying to do that. We're just trying to push straight back into like a retracted position with a little bit of overpressure. You should feel a pull here at the base of the skull. And you also may feel a little pinch or closing off of your airway here. Now obviously don't hold that too long and cause yourself to pass out, but just a little bit of pressure there. And I repeat somewhere between, repeat that for maybe 2 sets of 10 to 15 repetitions if you can, several times a day. That's also a great technique to help with an upper cervical headache as well. I hope these 3 tips help with your TMJ pain or dysfunction, and thank you so much for watching.